Good morning. It's Tuesday, September 20th. I'm Jessica Lovell. More than 2 billion people worldwide are living with a health condition that benefits from rehabilitation.
They say one man's trash is another man's treasure. We're going to show you how, in this case, this car is an incredible gift for the University of Kansas health system. It doesn't run anymore, but it has a huge role to play when it comes to getting patients back to their regular lives. We're going to show you exactly how they're using this as a wonderful tool.
And fearing exposure to COVID-19 while at work. A new poll shedding light 2.5 years since the pandemic began. Doc Hawk also has our latest COVID count. Thanks so much for joining us here this morning on Facebook, YouTube, and Twitter. According to Forbes, physical therapy ranks among the top 10 happiest jobs in the country. Many of today's physical therapy techniques date back thousands of years. The first use of massage and hydrotherapy goes as far back as 460 BC. Joining us here this morning inside the Dolph C. Simons Jr. Family Broadcast Studio is Rehab Unit Medical Director and Rehabilitative Medicine Physician, Dr. Sarah Eckmeyer, and Director of Rehabilitation, Julie Ginter. Good morning to both of you. Thanks for being with us today. And of course, we know our audience has questions, so get those sent in to us. You can find links to those right there on your screen, or you can post in the chat thread below. Well, let's just get right to it, Julie. It's not just sport injuries or post-surgery rehab therapy that we help people with. It's actually been COVID-related issues. Tell us more about that.
Sure. We've definitely treated a lot of COVID recovering patients on the rehab unit at the hospital. Basically, these patients have become so debilitated because of their illness. And on the rehab unit, we work to improve the function of those patients so that they can discharge home and get back to their community and their families.
And it's hard to believe because these are, in many cases, I'm sure, very somewhat strong, healthy people. Then
Sure.
they get COVID, something they never expected. What kind of actual therapy, techniques would you use on somebody who maybe was recovering from COVID?
Sure. Well, any person that is debilitated, of course, and unable to function at home or in their community is going to need to work on whether it's their mobility, walking, getting in and out of a vehicle as we're getting ready to see, being able to bathe and take care of themselves, cooking, even swallowing strategies, or speech, all of those things, physical, occupational, and speech-language pathology.
I always think of rehab as like the list of everything we take for granted that we do every day, don't even think about it, and then all of a sudden you find yourself needing help on how to get back to those little tiny things that we do every day. Dr. Eckmeyer, what are some of the other injuries that people may not realize might lead to needing to spend some time at rehab?
Sure. So I think traditionally we think a lot of neurologic diagnoses like stroke, brain injury, or spinal cord injury. But at our rehabilitation unit, we also care for a wide variety of patients who maybe were in the hospital recovering from something like pneumonia or COVID, but also after like a transplant, so like an organ transplant, a bone marrow transplant, sometimes even a car accident with multiple fractures. They need to spend some time with us in rehabilitation.
So fair to say most major surgeries might require rehab?
Depending on how people do after surgery, if they have medical needs and nursing needs in addition to therapy needs, they may need to spend some time in inpatient rehabilitation.
So people bounce back differently. Are people good about, when they've been told they need to go to rehab, going? Some people, once they get out of a hospital, it's like, I am done. I've done my time, and I'm might want to try to just get back to life on my own. But are people pretty good about sticking with their rehab regimen?
I think one of the best things about rehabilitation is that our patients are extremely motivated. They know that they want to get home and be as independent as possible. And so even if they're kind of eager to jump the gun and get out there, they're usually wonderful to work with. And our therapy team is just really great at motivating people, even if they're not entirely sure they want to do rehab. By the time they're done with us, they really, really like it.
It's kind of part of the total package. You gotta see it through to the very end, right, Julie?
Yes, absolutely.
So tell us, Doctor, what is hydrotherapy and what's it used for?
Hydrotherapy is a technique that any therapy that uses, water as a modality. I think it's not as popular maybe as it used to be. But there is still outpatient like aquatic therapy at pools and things that you can do in the water.
Okay, yeah, we've seen that a lot. Bit.ly link on the screen for more information. Check that out, bit.ly/MMU Rehab for more information on this topic. Julie, can you describe for us some of the equipment that you use in treating patients? What might someone find when they walk into your facility?
Yeah, so, and our patients don't walk in, Jessica,
Yeah,
most of them
exactly.
particularly.
I stand corrected on that one. You're right, you're right.
We've got a lot of equipment, and technology is constantly improving our ability to assist patients. So like a couple of pieces that are significant if you were to come to the gym would be our body weight support systems. So it allows us to actually harness and assist patients for walking and be able to facilitate that gait pattern and what have you without needing to bear the weight of the patient on the therapist. So those would be a couple of things that you'd see. You'd also see things that are similar to what you might find in a gym as far as a treadmill. We have some new steps, which are sort of a recumbent bike style kind of item. We've got some other technology related to, called the Armeo. It's a piece that allows us to work with patients with their arm function to facilitate that, particularly after stroke. Then you'd see things as common as a washer and dryer, a kitchen, things that we would need to practice with patients that they simply need to relearn how to do these basic functions. We've got a practice tub, same kind of thing, where the things that you think, oh, well, that's just basic, but it's not. After an injury like Dr. Eichmeyer has referred to, it's really those basic things that, again, like you said, daily life skills that we need to help patients relearn so that they can get home.
Get home. That's the goal. Dr. Eichmeyer, the Rehabilitation Center is about to receive airline seats to help people learn. I'm sure when somebody's come out of the hospital, getting back to life, travel for many folks really matters. So how important is it to recreate some of these real life scenarios, kind of like what Julie was mentioning in the home, but then also just out and about in the world, with other people. I think that's too, trying to maneuver and get on an airplane, you got people, they're in a rush, and, just to help people feel comfortable and secure with navigating all of these real life scenarios.
Yeah, so we're really excited about the airline seats. I think one of the things you might not realize is that when people are leaving our rehabilitation unit, they might have to travel. And that happens more often than you'd think. You can't really control where you get ill or where you have a major accident. And so a lot of times when we are discharging people home, we're actually discharging them to the airport to get on a plane and fly home. And that we've recreated that situation as best we can over the past several years, but you can't really recreate an airplane. And so having the ability to practice that real life skill, I think, will be of great use for our patients to get home. Airplanes are one of the last public transportation vehicles that are not accessible to people with disabilities.
Yeah.
And so we really have to help our patients problem solve that.
And I don't think we realize how weird positions we put our bodies in trying to get across somebody in an airline row, and they can be pretty funky. So yeah, I can see why that would be take someone quite by surprise. Right, something that they used to do all the time. Well, getting in and out of a car, of course, is something that is a daily activity for most of us. Alexis Del Cid is live outside the Rehab Center, showing us how patients are literally getting back in the driver's seat. Good morning, Alexis.
This is so incredible, Jessica. I'm here with Gretchen Schrader. She's a physical therapist. You've been a physical therapist for more than
20 years.
20 years. And what I'm going to do is I'm going to recreate and play the role of the patient this morning. And Gretchen is going to show us how she would guide a patient through this experience, because this is a new donation for you. Until now, you've had to have patients, families bring their own cars here to practice.
Mm-hmm. And with people living further out into Kansas and different places, sometimes their personal car isn't available to get here. So you're trying to make do with what you have or mimic it upstairs on a mat. And what ends up happening is that it's just not the same. And so when you get to the car, it's difficult, and then trying to figure out how to educate a family member when you're still working through how, if they're helping, how to have a patient do it themselves.
Right, and if a patient lives alone, they're going to be relying on a ride or Uber and such, and so they won't be able to have someone come here to recreate it. So I'm the patient and I'm on the walker. How would you help me get in and out? This can be done from a wheelchair as well, but for this purpose, we're using more of a standing situation.
All right, I'm going to have you walk towards the door here. I'm going to switch to your side.
Okay.
I'm going to have you turn and face out so your back of you is facing the seat, and you're going to back up all the way to till you feel the car behind you.
What's the trickiest part for patients, do you find?
Everybody wants to step into the car, and most of the time people have weakness that they don't, and balance issues that they can't just step in like they automatically did before. So it's teaching them to go ahead and have a seat first, and then lift their legs into the vehicle. All
right, so sit back.
Yep, and make sure you watch your head.
So trust that the seat's going to be behind me.
Head. Okay. And then you're going to step your legs into the vehicle.
Okay. So that's the trickiest part, is not stepping in first, just letting your backside kind of just trust fall into the seat.
We don't like the word fall.
Right.
Gently sit into the seat.
And then how do you work on getting out?
So I'm going to back this up just a little bit. I'm going to have you step your legs out. We'll do just the reverse of what you were doing before. Okay.
Now, getting in and out of a sedan, I find to be uncomfortable for me, and I'm not struggling with any challenge right now. It's just an uncomfortable thing to get in and out of a car. So how do you tell someone?
So the biggest thing when you're getting out is you need to make sure you shift your weight forward and get your weight over your toes, and then you're going to push up through your legs.
And where do I?
You want to push from the door frame here, and the seat behind you if you can, if there's enough space. There you go.
Okay.
You don't want to hold on to the door because the door might close on you, or if you pull on this, it's going to roll back towards you.
Okay.
So then you're going to grab onto the walker, and then you'd walk
then move
from
away.
Here. Yep.
How long does it take before your patients, when you've had to do simulations, feel confident enough to be able to do this?
It depends on their level and their confidence in themselves to start with. So some of it is just building the confidence to do it. Some people can do it once and then they're fine. Other people need to practice multiple times, and then they also need to practice with family if family is assisting them. So there's times where we'll do it 5-6 times. On different days.
But the key is, and if you're watching this from home and you might have some balance challenges, or you're getting back on your feet and you don't have the luxury of having Gretchen here and this donated car, the key, what I'm getting from you, is don't try to step into the car, you back up and then sit down and watch your head. Well, this is great, and we're going to talk with Gretchen a little bit later about the history of this car and the donation, and we're going to be taking some questions from our audience as well. We also have video of when this car was first delivered here. It was such a special day. So we're going to bring that to you guys in a moment. Jess, I'm going to toss it back to you in the studio.
Julie, how important is it to have a donation like that? Is it?
It's incredibly important. So I think what people may not realize is that it's no different than practicing an instrument or practicing a sport. It's that practice of real life scenarios, like having the car, as opposed to practicing on a simulation with a mat and a chair, something that just doesn't match the real life scenario. So it's incredibly important.
Anything else you're looking to be donated? That car is certainly nice, but we're going to hear more about the guy who did it. But anything else that you're going to have the airline seats coming shortly?
Yes.
Car, anything else on the list?
So we don't have anything like that on the list that we're looking at. There's always, technology and equipment. We've had some generous, very generous donors and grateful patients over the years that have donated various equipment items for us in order to rehabilitate the patients. But I think with the car and the airline seats, I think we're set for a while. We'll see.
We'll see.
We may, if everybody starts driving a truck, we may have to switch gears.
Oh, absolutely. There, like the pun. All right, let's turn to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with our COVID count this morning. How are you on this Tuesday? Good. It's Tuesday.
It is Tuesday, yeah. Yeah, right now in the hospital, we have 35 active infections. We have 4 in the ICU, 3 on the ventilator, still 22 in recovery period. But again, we are going to be looking at the trends as far as the patients, just because we know nationally, and even through the MARC data, we know that diagnosed cases and hospitalizations are decreasing. We seem to be staying fairly high for one reason or another. Certainly, I think transfers, but also patient mix, significant comorbidities, and we know that a vast majority of the patients that we have here in the hospital are either unvaccinated or not fully up to date with their vaccine.
All right, Dr. Hawkinson, a couple questions for you today. President Biden said during a 60 Minutes interview that the COVID-19 pandemic is over. Do you agree?
Yeah, I mean, I think we have to define what we mean by the pandemic is over. Certainly, different countries have different views on that. different communities even. One scientist said that, the pandemic is over when we get back to our regular lives, even in the presence of that circulating virus. And I think most people have done that. Certainly we know that there are that at-risk population who feel that there should maybe still be some more mandates or restrictions, such as masking. But we know that the vast majority of people in the United States now are going about their lives and really not taking too much concern with the circulating virus as it is. Unfortunately, we know that it is still circulating because we know that, employees are still getting sick, missing work, things of that nature. But I think it has to be really how you define it. And the vast majority of Americans really are going about their daily lives without giving too much concern or thought to the virus at this point in time.
Well, that leads me to my next comment and question. A recent Gallup poll found that 1 in 3 U.S. workers, they are very or at least moderately concerned about COVID exposure in the workplace. Is that a legitimate concern? And maybe what can we do to protect ourselves?
Yeah, I think it is. It's very legitimate. It has been a huge concern since the beginning of the pandemic. Think about the people that are working at the stores that we're seeing every day and going by and paying for our goods. Think about the teachers and administrators and counselors and those people in the schools who are around a lot of different people, especially kids and pediatrics. So I think it's a very real issue for a lot of businesses, a lot of areas of employment. But again, we know that there are things that you can do to try to protect you as much as possible. Obviously, wearing a mask is always okay, but also trying to distance. If you're doing something that's going to be harder than others, frequent hand hygiene as well. And again, take your individual health into account, and please stay up to date with vaccine and vaccination. But it certainly is a valid concern for a lot of people in a lot of workplaces here in our country.
Well, coming out of the White House, they're saying it's best to get the new booster before Halloween. Your thoughts on that?
Yeah, I think that's right. Again, the CDC recommendations is never miss a chance to vaccinate. I think that's totally true. Now, if you've had COVID and had been infected with SARS-CoV-2 in the last, say, 8 to 12 weeks, I think you can push that off until you get to that 8 to 12 week mark to vaccinate. We know that cases are going down, circulation of the virus is decreasing, but it is still quite high, so I think that is reasonable. If you do it then or by this time, you're going to have that significant protection probably through the winter, which is going to be important as we, expect. We can't predict very well, but we do expect there to be other surges in the winter, just as currently, other respiratory viruses do seem to surge in the winter. Even though we've recently come out of a surge, it just seems like with even that Delta Omicron. But overall, cases are going down. But I would agree with that recommendation as well.
All right, Doc Hawk, thanks so much. Let's head back out live with Alexis Delsid. She is live this morning at our rehab center with this car that was donated by someone so generous in our community. So Alexis, good morning. Tell us a little bit more about that.
Well, we were here, Jessica, when Mike Lane came and donated this. Now, Mike is the manager of the Auto Donation Center here in Kansas City. Take a look.
I was speaking to my friend Gary, who works with KU, and he was expressing to me the need that the rehab center had for a vehicle that they could teach their patients after they suffered a stroke or other debilitating things how to get in and out of a motor vehicle, and that they were in need of a car that they could actually physically try to do it. So we went and found the car for them, and we brought it here today to donate it to the rehab for us.
Such an amazing gift, and this is one of those things that a lot of us take for granted, how to get in and out of a car. I'm back here with Gretchen, who's a physical therapist that's going to be helping train patients. Gretchen, this car is not drivable, correct?
Correct.
So it's strictly for what purpose again?
So we will work with patients to work on having them be able to get into the vehicle themselves. We also are intending to get a car seat for the back. We have patients of all different ages, and so working on being able to get a child in and out of a car seat is very important for some of our patients.
Oh, that's something that so many of us watching wouldn't think of, is something of that nature. What is the most valuable piece of guidance that, again, you could give people who are sitting at home watching this and watching the demonstration that we did earlier?
So if you're having difficulty getting into the car, it would basically be that you would be sitting your bottom down in the seat first and then stepping your legs into the vehicle versus actually standing and stepping in, because that takes more balance and strength.
This has been a great demonstration for our viewers, and how generous that they got this donation. You know, just because a car doesn't run anymore doesn't mean that it can't be a great service to people in the community. Really a fantastic demonstration, and thank you for demonstrating with us today, Gretchen.
You're welcome.
Alexis, before I let you and Gretchen go, I do want to get to a community question that we have this morning from Yen Liang. Gretchen, if the car is too high, do you have tools to help someone get into the car?
We do, and usually we help work through that because cars are so varying, different heights. It might be a step stool, it might be coming up to a curb and standing on the curb and getting into the vehicle. It all is very individual, so that's why most people are having a little bit taller vehicles now, but we also have times where we need a lower sedan like this, so that is why we got the sedan, so we can practice those. And then we have other options to try and work with some of the taller vehicles, and we'll decide that based on what each person is needing.
Yeah, start and work your way up. Ladies, thank you so much for the demonstration this morning. We appreciate it.
This has been a gift to see this gift. Thank you, Gretchen.
Yep.
All right, so let's get to some other community questions. Julie, Gus wants to know if rehab is covered by most insurance companies, or how much would somebody expect to pay maybe out of pocket?
So it is covered by most insurance companies, so I think that would be individualized for the insurance as far as the out-of-pocket expense. But that's something that, so patients are coming directly to us from the acute care hospital, so from the main hospital coming directly to us, and we ensure that all of those authorizations are in place before they come to us.
Jesse says that he's an athlete. Dr. Eichmeyer, he recently sprained his ankle, broke his foot while playing football. What might be a typical treatment plan? Jesse isn't your patient, of course, but what might be maybe even just an athlete's recovery process for a injury that they might sustain during football or another sport?
Yeah, so luckily we have a lot of sports medicine colleagues here at University of Kansas within our rehabilitation department and our rehabilitation medicine department. So probably a good evaluation by a sports medicine physician to personalize a therapy prescription so they could help recover and get back to sport.
So oftentimes that getting back to sport sometimes takes a different route.
Yeah, rehabilitation is interesting. It's not one size fits all. We specialize in different areas. Sports, orthopedic, neurologic rehabilitation, all look very different actually.
Gretchen just mentioned how people in rehab are of different ages. So what might be the youngest and maybe the oldest? What's the span of ages? Maybe what's the youngest that we've had in our rehab?
In our rehab center, we can take down to probably like mid-teens, like 14 or 15 years old. If you're much younger than that, it probably makes more sense to be in a pediatric rehabilitation unit where they can also serve needs of families and get back to school, which is very different for younger kids.
Jen is asking, and Julie, maybe you can take this one, is it just physical injuries, or could it be for a neuro issue that someone is needing to help get back to function?
Yeah, absolutely. Our patients, our neurological patients particularly, many of them have work that they need to do on some cognitive deficits as well. So, an injury to the brain is definitely can cause cognitive deficits, balance deficits, can cause speech again, the ability to speak, the ability to understand, the ability to swallow, lots of things beyond physical.
And last question's from Hank. He's asking, are there any injuries that might require lifetime rehab? Or someone to at least be coming back, annually, just to check and see if things are going in the right direction?
Yeah, absolutely. I think our neurologic patients probably have more of a lifelong disability, and those patients probably need the most rehab within the first year after their injury. But even years after a stroke or a brain injury, there probably is need to follow up with a rehabilitation specialist, either in one of our clinics, to kind of do a checkup, and also as needed might go back to therapy throughout their life if they continue to struggle with different deficits. Yep.
Great topic today, ladies. I want to get to our final thoughts from our guests. And Julie, let's just start with you. Just kind of anything I didn't ask you or something you'd like our audience to know just about making sure that they're asking the right questions and finding the right place to get back to life.
Absolutely, absolutely. I think what makes our rehabilitation unit unique is that we have specialists that are certified, whether it's physicians, nurses, therapists, that are certified in rehabilitation. And that makes a big difference. Their training is specific to rehabilitation. And because of that, we are able to discharge more patients to the community than our regional and national benchmarks. So, our patients are going home, and that's critically important. That's where people want to discharge to, right? Not to another facility for additional care. So I think that makes our program unique. I think we have great tenure and experience in our team. They work incredibly well together. It is an amazing group of interdisciplinary people that come together on a unit, on an inpatient unit of the hospital to care for patients. And I think that's what makes rehab so special.
That's unique because there's like that collaborative, like you said, bringing in somebody from sports to talk about a specific sports injury. Quick question that I just came up. Do they have homework when they go home? Are you telling them you got to make sure you're doing this and you're doing that? What might they have to do?
Yeah, so many of our patients continue with outpatient therapy once they get home. So the typical stay with us is about a couple of weeks, and then their rehab journey is just beginning from there for many of them. So yes, they have homework, but then we also might recommend either home health or outpatient therapies so that they continue with their recovery.
Yeah. So you're giving them the tools to then go and take control.
Absolutely.
Final thoughts for you today? Anything that we didn't cover that we need to make sure folks need to know about? Or
Yeah, I think one thing that's really unique about our rehab unit at University of Kansas is we also partner with clinical researchers at the University of Kansas Medical Center. And so right now we're enrolling in 2 clinical trials for stroke recovery research. That's a very unique opportunity that doesn't really exist at a lot of inpatient rehab facilities. And I think it really is a huge benefit to our patients to be able to participate in additional innovative therapies that might supplement or improve their functional recovery.
So expand on that, because we may have listeners who think, wait, that might be for me. So who could possibly enter into that trial, and how do they do that?
So the 2 trials are for inpatients, so
Okay.
people who are currently recovering from a stroke and still in a hospital setting. So while they're in our inpatient rehab facility, we can see if they're eligible, and if they are, then we have our research team approach them in the rehab unit.
And then just what might you hope to find from a trial like that? What type of research are you hoping to gather? Would you do? I don't think people think of a rehab trial. So we do talk about trials here on this show, but a rehab trial, very interesting.
Yeah, one of the trials is looking at sleep after stroke and how that sleep quality might be different, and also how that might affect their function and their functional recovery. And then the other trial is looking at using a neuromagnetic stimulator to stimulate the brain, and in hopes that it will help enhance the recovery from weakness of hand function after a stroke. So both very different, but very promising as far as.
Yeah, for future people listening who may need that help down the line. Ladies, thank you so much. Really interesting topic. I learned a lot. I hope our audience did too. Dr. Hawkinson, wrap us up with some brilliant final thoughts.
Yeah, I don't know if it's be brilliant, but I would like to say that, working with our physical medicine and rehab colleagues is so great. We know that anytime you come to the hospital, even for a minor or short stay, you can still get so debilitated just because you tend to be in the bed recuperating, things of that nature. So certainly our rehab colleagues help improve that and get you home and keep you safe by doing that. We also know that it should be upon you to help reduce your risk of getting ill and coming to the hospital. And of course, that is going to be by being up to date with your vaccines. We know people that come in even for COVID-19 illness can have a prolonged stay, and especially if they're in the ICU where they get so debilitated. So it's vitally important to reduce your risk of having those things happen to you as much as possible.
Doc Hawk, thanks so much. Let's get to some headlines this morning. Lung cancer CT screening scans can catch tumors at an earlier and more treatable stage. That, according to a new study from Kaiser Permanente and the University of Pennsylvania Health System. Researchers found CT scan screens were catching about 20% of the lung cancer cases diagnosed. The study also showed that the screening did not result in overdiagnosis, which can cause patients to undergo unnecessary biopsies and other follow-up testing. Well, take a look at this piece of history. Archaeologists have discovered evidence of a surgical amputation performed 30,000 years ago. The skeleton of a young adult was discovered in a cave on the island of Borneo, and it was missing a foot. The skeleton also had evidence of a well-healed neck fracture and trauma to the collarbone. Researchers say this proves those living in Asia had more medical knowledge than what was previously recorded. Those findings, though, were published in the journal Nature. All right, feeling a little picked on here this morning on this next story. Okay, so how many of you end up having sometimes a little too much wine? Well, some say you can never have enough. Psychologists at Cambridge University say by using a smaller glass, here's the trick, you can fill it all the way up and drink 7% less every time. They say by seeing so much more in the glass filled up, you're tricking your brain into thinking you're drinking more than what you are. All right. Yes, tip of the day. According to the International Organization of Vine and Wine's annual report, Americans drank 872 million gallons of wine in 2021. All right, good fun facts to end us this morning. Thanks for being with us today. Don't forget, you can catch our updates anytime by logging onto Facebook, YouTube, and Twitter. Go out, make it a great day, and we'll see you back here tomorrow. Dr. Stites is live from Las Vegas, so we'll catch in with him. Make it a great day.
I'm heading out for a medical conference that is really all about you. I'm Dr. Steve Stites. Join me live on the next open mics from Las Vegas to learn what the nation's premier professional organization dedicated to improving patient outcomes wants to learn from us about this program. See you Wednesday, 8 a.m.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now everywhere podcasts are available.